Let's get into our first topic now. Should nurses strike over pay? 0207 862 2222 is the number that you need to get your calls in. Now, the Royal College of Nursing's ballot on whether to accept the offer of 3.6% pay rise, that closed this weekend. They're expected to announce that the overwhelming majority rejected that deal. Now, we should say the 3.6% figure was put forward by the NHS Pay Review Body. It's a separate body, but the government had only been budgeting for a rise of 2.8%, so a little bit more than what the government were planning to give nurses. Now, meanwhile, of course, resident doctors are still on strike over a 5.4% boost, which they were given this year because, well, they actually would quite like 29% instead. Now, that's on top of course, the 22% pay rise that they were awarded last year to get them out of strike action. So would nurses be right to join doctors on the picket lines? Let me know your thoughts. Michael, nurses are saying, look, this is not even, depending on which figures you're looking at, matching inflation. So they are unhappy, they feel undervalued. Should they strike?
I mean, I think yes, and I think most of the public kind of do agree that nurses are underpaid. I mean, of the people I know who work in the NHS, it just sounds like everyone's quite miserable because you're working in a system which is collapsing. Most people want to be doing a really good job. They feel like at the end of the day, they haven't felt like they've done the best job they can do because the system is collapsing around them. And then they're not getting paid enough to pay their mortgage. You know, I know people, two people with degrees, nurses, and they've had to leave London where they're from so they can buy a house and raise a kid. And it does seem like if you've got a dual income family doing a professional job, they should be able to live in the place they were born and raise a child.
Nothing wrong with having to leave London. No one's entitled to live wherever you want to. I mean, if I want to live in Knightsbridge, I can't, you know. But at the same time, I do agree that they are underpaid, but I think we need to be really careful with, you know, asking the government to just keep on paying out and paying out and paying out because it will just land on our laps to have to facilitate that via taxes. There is so much waste in the NHS, where Streeting came out in multiple interviews to say that NHS yearly wastes 10 billion, 290 million on people that inappropriately turn up to A&E, or on paracetamols, all these sorts of things.
That's because they can't get an appointment at their GPs.
But what needs to happen, that still doesn't facilitate the whole 10 billion is a lot of wastage.
Sure.
So
but we've been talking about wastage in the NHS for what feels like decades.
Well, maybe we need to get the auditors in to see where's this money going, because you can't just, if, for example, if we all had a child here and we gave them £50 pocket money and they didn't do what was necessary to stretch that out over the week for their lunch meals, you're not just going to keep on giving them another £50. You're going to say, listen, stop getting expensive meals or try and look at what you're spending every day.
But you're saying now that they shouldn't strike, even though you're admitting that they are underpaid.
No, I think they need to direct their frustration at the NHS, at whoever is in control of the finances, the heads of departments. I don't think, because all the striking is trying to, place pressure on the government so that they will go in the pockets, and then we will have to see. We've already seen conversations around tax rises. We can't just keep on. There's a hole somewhere in the NHS. We keep on putting money in it and it's dropping out the other side.
Go on, Mike.
I mean, I think there's some wishful thinking there. I think everyone says, God, the NHS, how could it possibly be costing this much money? It must be because it's wasting the money. And it just so happens, actually, that healthcare is really expensive. So we spend a very similar amount on healthcare to the rest of the world. We have an ageing population. We are going to have to spend more on healthcare. The more we try and cut corners and say, OK, let's make that little bit a bit cheaper, then normally what happens is that part just collapses and then it pushes the cost elsewhere, like you were saying with GP appointments.
Okay.
If you can't get a GP appointment, you turn up in A&E.
I can tell you, just for reference, starting salary for a nurse is just under £30,000. And looking at France, Germany, it's roughly the same. It's 30 to 39,000 euros in France, 33 to 38,000 euros in Germany. In the US, though, they start on a salary of about $60,000, a lot more. Let's find out what people are saying at home. Mike's in Liverpool. Mike, I believe you've got first-hand experience here.
I have indeed. I'm 45 years qualified as a nurse. I'm a hard-working trade union rep within the health service as well. And I think the debate up to now has revolved around the problems of the NHS. and not the problems about our nurses and the way they're paid. And up here in the Northwest, as part of the cost improvement programs, we've had all our overtime banned, and we are now being forced to work overtime on 0-hour contracts at anything up to £11 an hour cheaper than our substantive contracts. And that has a huge impact on a female workforce, because it affects statutory maternity pay, it affects annual leave for part-timers, and also the other big issue as well is that in the NHS we run the biggest, most comprehensive equal pay for equal value work.
Yeah.
And as a band 5 nurse, which I've been all my life because I'm a bedside nurse, we've never had our jobs evaluated for over 20 years, and I'm a bit of a geek on equal pay. And I know that in my hospital, our ICU nurses on a band 5 will come out as band 7s, which is a substantial. So not only are we getting a proper reward for our jobs are undervalued by our employers.
Mike, what does it feel like for someone like yourself with all that experience working in the NHS to have to withdraw your labour? There must be a conflict, because you have been trained alongside doctors that your top priority are your patients. What does it feel like to have to walk out?
It's a killer. It kills your spirit. It kills your enthusiasm for the job. And that's what nursing is about. Our job revolves around patients. In my case, it revolves around children. But at the end of the day, is that if we're going to have a future for a nursing workforce in this country, we've got to tackle the issue of pay, because nowadays we don't attract all the 18-year-old students into nursing. There's far better paid jobs for them, and there's more creative jobs to go to, and we have to compete in that arena. It's no mistake that internationally we've recruited lots of nurses from overseas, because we can't recruit within this country.
Mike, just briefly before we go, because I want to take advantage of your expertise. Lynn was saying, look, one of the big problems, as Wes Streeting said, that £10 billion worth of wastage. You've spent a lot of time in the NHS. Do you see money being wasted all around you?
Do you know what? All these commentators, whether politicians or commentators on your show, come up with these big round figures. I know up here in Liverpool, trusts have got a £29 million cost improvement programmes running now. And that's meaning that we're having to make clinical staff redundant and stuff like that. And there's always waste in everything, but I don't believe it's 10 billion. The problems are, as one of your commentators has said, they're coming to aid accidents and emergency. Well, that's right, because we don't fund general practice.
Yeah.
We haven't got enough GPs. We haven't got enough community nurses. Our community nurses are starting to be eradicated out the system. So the waste comes from inaction. It doesn't waste because we're wasting lots of stuff.
OK, Mike, thank you. Really invaluable to hear from you, someone who's there actually doing the job. Let's move on to John, who's in London. John, welcome to the show. What would you like to say, John?
The nurses has got 100% backing by me, and I've got proof of the reasons. My wife had a bad accident recently and spent in a 6-bed ward in Homerton. And the nurses were unbelievable. You've got patients in there, 4 at least, were incontinent and were being changed 3 and 4 times while I was there during the visiting time. Yeah. The same patients having this, and I don't think if they doubled their wages would be sufficient.
Yeah. So they're being undervalued, which is...
I don't believe in strikes. This is the thing. I don't believe in them, but I think this is one strike that I would be 1,000% behind. Okay. I don't believe in them.
John, thank you. Thank you for that call. Maggie's in Suffolk. Maggie, I believe that you used to be a nurse?
Yes, I was a nurse for 47 years and I was a practice nurse for 20 years in London.
And do you support the strike?
I don't really. I do worry about the patients' care. We've got backlog of everything and patients are waiting long times for things, and I don't think it's right. I think maybe a work to rule might be a better way of doing it, so that the NHS depends on the goodwill of their staff, and I think that might be a good way to do it, but I don't think we should strike. I think it's worrying. But we need to be respected. And
you think it's worrying because it's dangerous for the patients?
Yes, I do. And I think people are waiting long times and they're suffering, and that's not fair.
But then how do nurses get the pay that they deserve? I mean, do you agree that they're being undervalued and underpaid?
Oh, absolutely, they are. And, you know, your show, many times I've phoned up, actually, and also people like Lynn, who's on there, quite keen to say that, you know, if you affect the rich people, you tax them, they'll all leave the country. Well, we're getting what was going to come, actually, eventually, because, you know, the NHS workers have had enough. They are highly skilled, they are highly trained, they work hard, and they're not valued, and they need to be valued. But I don't think striking's the way to do it for the nurses.
Maggie, thank you. Thank you for your call. Thank you all for your calls on that. Now, don't forget, later, we're going to be debating